Good morning.
Good morning, sir.
Today I am going to introduce to you Mrs. Saida Asma from Bangalore. She has come from Bangalore and she has undergone this platelet rich trauma treatment or stem cell treatment for her knee arthritis. Today is the fifth day after the procedure. It was done last Sunday, and she is recovering well. I will introduce you to her, and I will ask her. I will request her to speak.
My name is Saida Asma. I'm from Bangalore. Um,
Age.
I am 46-year-old.
What are you doing?
I'm actually an IT professional, and most of my work actually is pretty sedentary, And I developed this osteoarthritis.
You didn't. You had knee pain. That's all.
I had knee pain from last 4 years. I was having difficulty in climbing the stairs. Every time I used to climb the stairs, I used to find that click sound and then pain, especially climbing the stairs. And then over time, last 1 year or so, I couldn't sit on the floor, cross legs, or when I sit, it was very hard for me to wake up. Stand up again, on my own. And then I saw a couple of doctors. They just gave me, some cartilage regeneration, whatever, supplements and stuff. I took it
in Bangalore.
I took it for nearly 1.5 years, and that didn't help. Every time it was more banded kind of a solution. Every time I took that, the pain was a little less, but then once I stopped, it came back. And that's when I approached one doctor back in Bangalore actually, and he suggested something like a non-invasive procedure. And he said a knee surgery, probably too young. But then that didn't really go away.
What did he suggest? Stem cell treatment?
Yeah, I mean something like that. He said I'll extract the stem cells from your fat. And then I will inject them into the knee area actually. And so I almost got prepared. I got admitted also for a day to get that procedure done. But then the doctor and by the way, I have a company insurance. I was trying to get cashless, and so this doctor was not giving all the details as to how he was going to be performing the surgery and stuff like that. And I wasn't feeling very confident, and my insurance kept rejecting the claim and the cashless claim. And they suggested that they're not very clear as to what he wants to do with this. So that's when I was very hopeless, and then I start looking on into the internet, and I found Dr. Venkatachalam's website, and I read through all of these. I saw a lot of similar cases that he has handled. So then me and my husband, we decided that let's go visit the doctor. So by the way, I called the doctor. I gave him all my details, and he asked me a few questions, and I didn't know a lot of that answer to a lot of that, but now I realize that how deep doctor's knowledge is about the subject. And how he was able to relate what was the underlying root cause of this, rather than just treating it superficially with a thing. So I really appreciate doctors care for his patients, that he really wants the underlying root cause to be fixed, so that we all can lead a healthy life. And I really appreciate it. It's very rare to find these kind of genuine doctors actually. So I came here, me and my family came here, and we requested doctor to do the surgery a little quicker, because my husband had a flight to catch for his company visit, company travel basically for the and so then it was done, and right after the surgery, the pain wasn't that much, and I could walk. On the same evening, the doctor came and he made me walk, and I could walk actually. Walk a few steps obviously, and then the next day, doctor sent me for the physiotherapy. After the physiotherapy, I'm feeling much better. Obviously, as doctor suggested, the overall complete recovery is going to take about 6 weeks. Just my 6 days into this procedure. I'm really happy, the care that the hospital, as well as mainly the doctor and the physio team have given. And I really, recommend anybody who is suffering from this, to benefit from this. And yeah, that's all. And I'm just hoping. I will record a follow-up video once, let's say after 6 weeks, to share my experience, like how post 6 weeks, how my experience has been. And I'm really looking forward to getting back my
mobility and lead a good quality of life.
Yeah, lead a good quality of life. And thank you so much. Especially, I really appreciate you addressing the underlying cause rather than just treating.
Now you have an idea of the cause.
Yes, sir. I had absolutely no clue that all these factors, especially of the obesity, the insulin resistance that you mentioned, all these could be contributing factor to my knees. Because I thought knee and these things are completely unrelated. But when I was, in fact, I was telling this to my sister, who is also a doctor. So
you got a ton of blood tests here.
Yes.
How many pages? Just check 25 pages.
Sure.
No.
So we got a lot of blood tests done, and most of them are revealed a lot of
information
areas that I need to work on. Things like HbA1c and insulin resistance, that tells how effectively my body is processing the food that I'm eating into the energy, and also my overall CBC hemogram that revealed that I am little bit of an anemic. I need to work on that. And also there seems to be my lymphocyte sites have been very high, which suggests that probably there is some
immunological reaction.
Correct, sir. Immunological reaction
To the knee joint.
Yeah. And I did my lipid profile, and that suggested that my cholesterol is pretty bad.
TGLSI, triglyceride.
Yes, triglyceride is pretty high, and that can actually lead me into little bit
fatty liver.
I have a fatty liver.
You have a fatty liver.
Grade 1 fatty liver.
Oh my God.
And my the cholesterol has been much higher actually, and I think that's also obviously is going to increase the risk of heart diseases as well as this one. And these are some of the calcium and other tests are done. Vitamin D. Vitamin D is obviously how effectively your body is.
So what is your overall impression from this, that everything in the human body and everything in our life is interrelated?
Yes, sir, absolutely.
Connected. So nothing in our human body is separate from the other parts or other systems.
Yes.
Everything is connected.
100%, sir. I learned that this was a very good, this was an awakening for me that
If something goes wrong somewhere,
it is going to have effect somewhere else. So, and especially things like your joints, your legs and stuff. This
is the new knowledge.
Yes, sir, absolutely. And this coming from someone who's a orthopedic person, it's really I was really impressed. And thank you so much for making me realize that. And overall, the diet that you suggested, the lifestyle changes that you suggested, that is going to lead me into a very healthier version of myself for a long run.
Good. Now you have the opportunity of the festive coming.
Yes. Yes, sir. I'm going to develop.
So Eid is coming in 3 weeks' time.
Yes, sir.
But what did they suggest to you?
Yes, you told whatever hard work that you do, intermittent fasting. And
do it every day.
Do
every week.
Yeah, and obviously during this Ramadan time, you're fasting, and then don't spoil it all by on the day of Eid. I have to actually work that discipline into my life. So, yeah.
Okay. Normally people will eat sevaya, sweet, at the end of the day.
Correct, sir.
No sevaya. You can, if you want, you can add some sugar-free substitutes into that sevaya.
Yes, sir. Yes, sir. That's. Obviously, I'm going to be in touch with you, sir. So, I will share my journey so
Oh, yeah.
how it's going.
Okay.
To be.
Thank you.
And thank you so much, sir.
All the best.
Thank you.
Keep in touch.
Yes, sir. Absolutely.
How's your impression of this hospital?
The hospital is very good. I mean, I must really say, comparing to the similar, setups in Bangalore, I was very touched, really touched, because the staff are very friendly here, and the doctors are pretty, very, very caring, patient caring, attitude that they have. The facility is clean.
How's the physiotherapy?
Physiotherapy was very good. Dr. Devraj, is a very knowledgeable.
What are you must have got some extraordinary physiotherapy over there.
Yeah, I mean,
what is that?
Yes, they gave me the first one they gave me was stimulation, the stimulation therapy.
Then
and then
what is the most advanced one?
And the second one was the shock wave therapy. What
Yes.
the Dr. Devraj explained, saying that what that will do for your joints is basically it's going to improve the circulation
And healing of the cartilage.
It'll speed up the healing of the cartilage.
Yes.
The surgery that you have done, to kind of graft the cartilage.
Yes.
That is going to speed up the process.
Okay.
Is what he said.
Um,
And yeah, I mean, and his staff is also very nice in the physiotherapy, Sri Krishna Physiotherapy Center. They're very friendly, and they're very. They will basically overall, what I felt was the care and the care and the compassion that they have for the patients was really good. And they'll explain to you whatever they're doing and how it's going to be benefiting. What are the do's and don'ts? Also they mentioned. So that was really, really helpful, sir.
Okay. Now for physiotherapy, you have seen that video on my YouTube channel.
Yes, sir. Yeah, I'm going to follow that at home, because now I'm going back to Bangalore tomorrow, sir. So obviously I will not be having access to.
Yeah, those are very simple instructions.
Yes, sir. Yeah, so I will try to follow those. And also, as you mentioned, sir, in my day, I need to make sure these exercises have to be part of my at least my life for next 6 months. So then only I'll get the benefit of the surgery that I've got it done. And I'm really glad that this is the least invasive the procedure, a non-invasive procedure, I must say, that I could get it done, because everywhere you see all these knee replacement, these robotic knee replacement, these are all the trends that are going on. I was very scared, when will I sort of have to go through all of the similar journey, but I'm really glad that that I managed to speak to you and get this treatment done, sir.
Thank you, Saida,
Thank
for
you,
having come and recorded this testimonial. I wish you all the best, and wish you that you make a about turn in your lifestyle,
Thank you, sir.
and go on the road to improvement and lead a long and healthy life.
Thank you.
Thank you. Bye.
Thank you.